most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
This is a
Bob.
hint to what we're going to be talking about today, Brad.
I thought
Today
it was the Fonz or something.
Thumb. Hey. Today we're going to talk about
yeah.
thumb and wrist pain, the CMC joints specifically.
Yeah.
And we'll show you what that is. It's an easy self-treatment for pain-free daily activities. And this is for a friend of yours, Brad.
That's right, Bob. This is for Peggy. Peggy, we're going to show you what you can do, some exercise, massage, maybe Mitchell.
Is her middle name Peggy Sue?
No, don't call her
All right.
Peggy Sue. You're going. She's a black belt, by the way.
All right,
Anyways,
I'll
carry on.
Watch my mouth. Okay, today, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
That's
also,
right.
go to bobandbrad.com, go to the giveaway section. Always giving something away every week. We have a one-day hiatus. Check it out tomorrow. It'll be
not to be confused with a hernia.
Yeah,
Hiatus.
That's a hiatus. Go to Facebook. It'll also be pinned to the top of the page, the contest. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Wow, that was a good intro, Bob. Okay, here we go. So, I was talking about Peggy. She says, oh, I've got wrist pain. Pushing off of a chair hurts. There's a number of things throughout the day that are irritating her wrists. And so I actually took a look at it. And I said, no, let's take a closer look. And I actually zeroed it down to, she had movement in all the wrists. And it was down to a spot right here was the source. But it felt like wrist pain. So this kind of could get confused a little bit. Misdiagnosed, you may call it. But anyways, it's the CMC joint, which is an abbreviation actually for, let's do this, carpal metacarpal.
Yes.
So let's show you right here. This is the best way to do it. I got Sam.
Very common joint to be affected. Very common. Probably one of the most common in the hand.
Sure. And, there's some good news for this because we can work with this.
Yes, we can.
Worst case scenario, they actually do a joint replacement right here. And for the most part, it's pretty successful. Obviously, nice to avoid that if possible. So here we've got the thumb, the little bone here, and then they got the carpal, and then we've got this long bone, and this goes up and right into the wrist joint. So this joint right there, can you zoomed in on that, Peggy?
Peggy?
I'm sorry, Liz.
Peggy.
I got Peggy on my mind. And it's right there, and if you look at it, it needs to move so your thumb moves. And it's real critical, and it's right there next to it's basically part of the wrist.
And it's multi-directional.
Yeah,
I mean, it goes
it is.
into, that's the whole thing about the thumb. It can go in all directions.
Right, that's what separates us from
something.
Yeah. I remember that in school. Anyways,
yeah,
we need to work with that joint, and we need to do it specifically. But before you do that, if there are things, like in her case, she talked about pushing off a chair, which you do without even thinking about it. Oh, that hurts. Stop doing that. Yeah. It's irritating it. It's just going to make it worse.
It's not helping. And don't test it either. Like a lot of people have pain. They'll go, I want to see if it still hurts.
Yeah.
Avoid testing it for a while. Let it calm down.
Right.
Because sometimes inflammation, once it calms down,
right,
the problem is solved.
And one way, because you do that without thinking about it.
Right.
But if you put a wrist splint on, you can have a generic one or one that supports
they
that
have a splint, right, that are made for the CMC.
Sure.
So you can actually probably go on Amazon and just...
And you could actually probably just get a standard wrist splint.
Yeah,
just
a standard would too. Yes.
It would remind you that those things that you do without thinking about it, the wrist splint would say, oh, yeah, that's right. I can't do that because it irritates it. Plus, it supports. So either way.
Splints can be very helpful. I wouldn't you necessarily wear it at night, but during the day when you're using the hand.
If you wake up and it's sore, maybe that you're sleeping on it in a certain direction.
In that case, you may want to wear it at night.
Exactly right. So I wouldn't put that out at all.
Sure.
It's very common with carpal tunnels. Same concept.
Yeah.
Different source of pain, however. Now the next thing, once we eliminate the common irritations, splinting it, or just keeping mindful track of what's going on with that joint, what we want to do is massage the muscles around the joint. We want to increase the circulation. A lot of times the muscles that control that will actually tighten up as a result of that pain. It's more than likely arthritic. The joint is becoming arthritic. The muscles get tight. The more the muscles get tight, the less the joint moves. When the joint does not move, the arthritic pain can get worse. So it's a compounding, like a snowball rolling down the hill. We need to break that cycle. And one of the ways is with the splint, and then we're going to massage these muscles. This happens to be known as the hypothenar eminence. No, I take that back. The thenar eminence. Here's the hypo.
So on the other side.
Or the thenar eminence. So I thought, why do they call it that? This is just on a side note. And thenar, if you look that term up, it means the ball of the thumb. So here's the ball of the thumb. And eminence, we know that it's an elevation. It can be other things too.
Your eminence.
Yeah, but here we're looking at the elevation of the ball of the thumb. So we're looking at the muscles. That's why it's the ball of the thumb, because there's muscles in there.
So Brad, would you also suggest, you get a massage that area, but would you also maybe hit the tendon there if it is sore?
I think you could work that. It depends on your response. First, we can maybe address the muscles,
right?
And you're going to get in there. If you happen to have it on this thumb too, that's a problem, because you're probably going to use your thumb more to get into those muscles. It's going to
irritate the thumb when you massage.
Right. Or you could, get your spouse or a family member, someone possibly to do this. But you really got to be careful, because it may hurt at first, but once you work on it for 15 to 30 seconds and you break those muscle knots up and you get things to feel better, if that's the case, then you can work it for a few minutes until your other hand gets tired.
Well, the other option, Brad, is
if you
massage gun.
Yep. This is an option, but you're not going to get the big one, the big powerful one. You're going to need to get a smaller one. And this one here works really well, just a little one. And even this one is a reciprocating gun. We're not going to go straight in. You might if you got a really big thumb, but if you go sideways, it really can work well, and you can work in and on there, and works really nice.
What's shocking about this, it's the Q2. This thing is really powerful, Brad, though.
Yeah, I mean, you got to be careful with it.
I mean, I use it on my legs, to my hip adductors and
But we don't have to get that personal.
Well, I'm just saying.
Just kidding.
It's amazing.
Yeah, it is. That's why you really have to do it at an angle, and I don't have it set on the highest setting. I'm almost on the lowest setting, and it goes
You can
fine.
really get good leverage with it. You know, I mean, when I'm working on my calf, you can really push into it.
We're talking about
I know. It's all about me.
Yeah. So anyways, and you can get to the joint and work around that joint, but you're only going to continue to massage that joint is after about 15 to 30 seconds, it starts to feel better.
Right.
If it just continues to be painful after that 30-second mark, and use the clock or a timer to look at that, then you're going to stay away from it, because you're just irritating.
It's too tender. You might even try icing it.
Yeah.
You might do an ice massage on it even.
Yeah.
So.
So we're going to work that aspect of it, the massage, and working the circulation and get it moving that way. And then the next thing is to actually get a hold. Let's get Sam over here. Again, I knew I needed Sam one more time. Is we're going to try and get a hold of this bone right here, okay? And on Sam, if we could do it, if you could grab the bone, Liz, if you want to, I thought I was going to call her Piggy again. I don't know what the heck's wrong with me. And we're going to try and get that joint moving. Mobilize it without too much pain. Now, one thing that sometimes works is if you pull on it, put a little traction. And then work the motion. Sometimes you can try to rotate it. So if you put it on a real person, Bob, you're doing it there.
Yeah, I was.
I'm going to grab here, but you got to grab through skin and muscle and tissue, so it's harder to get a hold of that bone. And you're going to work it. Now, one thing you can do is grab it with the other hand and kind of get a grasp of it like this or like this. And so you're trying to mobilize it. Get things moving, but don't get too aggressive. If it gives you sharp pain, that's too much.
Right.
Work it into pain-free or just a minimal pain, and then eventually break it loose. Hopefully we get some of that arthritis moving. Again, pull with traction, a little rotation. You do have to experiment with this.
And you certainly could do a little heat on it before.
Sure.
Which make it a little more amenable to having a mobilization. And I mean, you can put your hand in warm water and just let it.
And you may have, if you're really flared up because you're irritated all day, heat might not be the right thing. You're going to have to experiment with that.
Ice versus heat versus what they call contrast baths, where you do cold water and hot water, cold water and hot water.
Right. So, that a lot of people probably be the last thing because it's harder to. You got to set it up and you have to take time with it.
Sometimes it's a good time to do the range of motion, which you're going to talk about now.
Exactly. The next thing, range of motion. If you do heat it up and it gets looser as a result of a hot pack or doing the dishes or something in warm water, then simple touch thumb tip to fingertip.
Yep.
All 4 fingers gives
See,
you
the
different range.
thumb
of
is
motion.
having to turn and rotate
Yep.
when it's doing this.
And you can just work it this way as well. This way. We're just trying to get all range of motion. Again, if it's real painful one direction, avoid that. If say going across this way, ow, it hurts. Well, let's go back this way and do the opposite direction 10 times. And then you can go back. You can use the other hand to do a little passive range to get it moving. Once you get it kind of broken loose and it's feeling a little looser and not so painful, this might be a few days into it or even a week. Then I'm going to suggest get a ball, but not, this ball is solid. It's just a foam ball. Probably too much to get started. Bob, you don't have to leave.
No, I gotta come back.
So if you get one of these balls, like this has like a fluid in it, those are usually nice because they're softer and you can like go with different directions. Like I'm putting my thumb, I got Liz flying all over the camera trying to keep up with me. Sorry about that. And we can push like this. You're going to find certain directions are tolerated better than others. And you want to work the directions that feel better without creating sharp pain.
If that hurts, you can actually. This is one exercise. It's actually all you do is you grab onto a heavy weight like this. You lift it up, and that's isometric strengthening. That.
Sure. Yep.
So
by heavy weight, 3 pounds for
Yeah.
your thumb is pretty heavy.
right,
Yep.
right. So you just pick it up, hold it for 10 seconds, and then down again,
There you go.
and do 3 sets of 10.
Yep.
So
This other thing, you take
Oh,
a
there we
simple
go.
rubber band. Now, you put it like this, and I found out if you do this, it kind of happens like that. So
Right.
just twist it up in your fingers a little bit. So I've got it going around my pointer finger and my pinky, and so that way it stabilizes it. And all I'm going to do is bring the thumb out this way, offers a little bit of resistance. And you really don't need much more than a band.
You can go out to the side, and you can also just go straight forward.
yeah.
So
You don't need a big band because your thumb, when you go out, you're not grasping thing for power. You just want to get
Right.
the thumb to move. So a small rubber band is more than enough. All of these, 10 to 15, maybe 20 reps if it's feeling good. Do that. I really think you can get that joint loosened up if you follow these steps, step by steps. Don't overdo it. And, take care of yourself.
and remember to give us a thumbs up.
Yeah, thumbs up. That's right. I thought you were doing the Fonzie thing. What the hell's going on?
Hey.
That Fonzie statue is in Milwaukee.
Is it really?
Yeah,
Henry
that's
Winkler?
Yeah, he's down there. He's a full life. He's short.
Yeah,
At least
he
the
is short.
Yeah.
Yeah.
And he's down there. You could get a picture taken with him.
All right, cool.
That'd be fun with you. You're about
Hey.
3 foot taller than him.
Yeah.
Just a side note.
All
Take
right.
care.
Thanks for watching.